You look at the numbers, and the fact is Florida is the biggest hotspot for the latest COVID surge. As we've said, it is fueled by two things, the Delta variant and vaccine skepticism. As if Northeast Florida needs another dose of reality, UF Health Jacksonville broke its record for the most hospitalized COVID patients Monday. Numbers jumped again yesterday. Joining me on the morning show is the CEO of UF Health Jacksonville, Dr. Leon Haley. Appreciate your time, sir.
Good morning, and thank you for allowing me to join you.
The hospital's director of infection prevention, Chad Nielsen, was quoted as saying, "We are gaining cases at such a rapid rate, we don't really know where it's going to stop." Is Duval County at a point where the worry is not what happens in a couple of months, but in the next week?
I don't even think it's the next week. We're looking at the next couple. We're taking this day by day. As Mr. Nielsen said a couple of days ago, the curve is really not even a curve. It's a straight line up. We are seeing the highest number of cases we've seen since the surge started last year. And so at this point, we're trying to make it through each day, not even thinking about a week from now.
You'll be joining the mayor and a group of other area medical executives at noon today during a news conference, which will be aired right here on News4Jax. There's obviously an urgent message that needs to be communicated. There is a vaccine hesitancy in this area. You have people who are scared, others who are hesitant based on misinformation, and frankly, a web of repeated lies. How do you convince them about the vaccine's efficacy, its safety?
Well, we try and go back to the science, remind people that it did go through a rigorous protocol. Yes, it was faster, but that's because we got rid of a lot of the bureaucracy that tends to surround vaccine and drug development. But truthfully, at this point, we're going one-on-one. We're asking many of our vaccinated faculty and staff to actually talk to unvaccinated faculty and staff and to citizens on a one-by-one basis and try and dispel all the myths. We actually just taped a town hall with many of our leaders and many of our experts that we're going to show to all of our staff this week. So we're taking it day by day, moment by moment, but really trying to change the way people are thinking about this. As you said earlier, 90% of our hospitalized patients right now are unvaccinated. And we've seen more deaths in the last 2 weeks than we've seen in many months. And almost all of that, not almost, excuse me, all of those are unvaccinated citizens.
You just alluded to this. You have people in the health community who question the vaccine safety, and there are hospital staffing issues as a result. Doesn't that just compound the problem? Because now you just don't have COVID patients who can't get needed care, heart attack patients, and others who need hospital care.
Yes, I mean, we are definitely stretched. There's no question that our nurses are working overtime. Many of our staff are working overtime. And yes, unfortunately, we have not convinced some of our own staff to get vaccinated. So we're only at a little over 50% of our staff that have been completely vaccinated. And unfortunately, that's created a lot of them to actually turn positive or be out on quarantine. So you're all right. It is doubling up the problem and is creating a lot of stretching for us across both of our campuses.
Back to the vaccine issue. It has been political from the get-go. You still can't get the shot in a doctor's office. Is it time to take the politics out of all of this, make it available through the healthcare providers that people trust? They can go to the doctor's office and say, look, let me talk to you about it because you're the one who knows me best.
Yes, I would say at this point in time, whatever we can do to get vaccinations, get people vaccinated in their arms, shots in arms, as we talk about, the better. And now some of that is logistical. So the Pfizer vaccine, for example, requires ultra cold storage, so it's not easily transmitted to the average physician's office. Moderna has also some challenges. J&J is probably the most available for the average practitioner. So there are a few logistical issues. But that being said, we've had vaccines available at UF Health. Many of the private industries like CVS and Walmart for a long time, and people are still not taking it. So we still need to work on information. We still need to work on sort of one-by-one sharing of all of the details and making sure that we can make people feel comfortable taking the vaccine.
We started this interview by discussing the urgent problems this area faces right now. There are those who believe COVID may very well be endemic, like the flu, and not pandemic. That said, if it continues out of control, if other virulent strains develop, as we move toward winter, do we face a possible hellstorm?
We do. I mean, we're in a health storm now. So let's be very clear. As you've alluded to at the top of the hour, you know, our hospitalizations are higher than they've ever been. Hospitals are already making adjustments around visitors, elective surgeries. So we're in that health storm now, and it can get worse. Now, it can also get better if we can get more people vaccinated. At the very minimum, we need to probably make sure people are still wearing masks and maintaining their social distancing, particularly in indoor settings. So we have a way through this, but we're just going to have to rely on our medical medical experts, our scientific leaders, and help them, continue to transmit the message about the safety of the vaccines and getting people vaccinated. But if you're right, if we don't do this and the virus continues to mutate and comes up with the next strain, we could be even for a worse winter.
And masks is a whole nother issue, and masks in our kids in schools, whole nother issue, which I'm sure you'll be talking about during the mayor's news conference at noon today. Dr. Haley, thanks very much for your time.